Good afternoon. This is the recorded lecture for Chapter 5 of our textbook. It's the second of the 3 chapters that we are covering this week. Unit 2 is Chapters 4, 5, and 6, and for the next few minutes, we're going to be talking about the nurse as manager of care. Our objectives for Chapter 5 include defining the term management and what it means. We're going to talk about several different types of management theories, including servant leadership, and we will discuss behaviors and qualities that contribute to being an effective nurse manager. As a nurse, it's important to be both a good leader and a good follower. If you're in middle management, you'll still be a follower of the nurse executive, the hospital administrator, so on and so forth. So it's kind of important to feel comfortable in both sets of shoes at any given time. So how do you know when you're ready to be a nurse manager? Sometimes people get pushed into management if they have really good clinical skills, but if you're still new as a registered nurse, it might not be quite time for you to accept a position in nursing management. In addition to developing your skills as an expert clinician in registered nursing, you will need some time to develop expertise in supervising other people and helping them to develop their own skills. There is no set time frame in which you would develop this. I wouldn't say 1 year after graduation or even 5 years after graduation. It's kind of your own benchmark, but you will need to have some expertise in management before you accept a position. So what is management? It's the ability to get the work done by supervising others. You need to do whatever is needed to make sure that nurses are taking care of the patients and doing an excellent job. According to our textbook, 2/3 of any manager's time is spent dealing with people problems. And then whatever time is left over, or the rest of the time, which is about 30%, would be used on the budget, attending administrative meetings, report writing, and other administrative tasks. So now let's take a few minutes to move on into discussing management theory. So there are 2 opposing schools of thought about this. One is scientific management, and then the first one we're going to talk about is human relations based management. So in human relations based management, there's an emphasis on the interpersonal aspects of managing people, as opposed to the scientific management theory that is very task-oriented. In scientific management, the emphasis is on productivity and efficiency. For example, is it better to send a disabled patient to physical therapy as opposed to sending a physical therapist to see the patient at their home or on the inpatient unit? Scientific management focuses on productivity, staffing ratios, and so on and so forth, mostly about the budget and cost containment, and not so much on the human elements. So nurse managers who are using scientific management talk a lot about efficiency, productivity, getting things done, and they're very task-oriented. They keep a lot of records and they tabulate a lot of data on how things are going, and they tend to reward nurses who are the most productive. Another model of nursing leadership is called servant leadership. Servant leadership is based on the teachings of Jesus. It is not a religious theory per se. It focuses on serving others. And in servant leadership, the role of the nurse manager is to see themselves as being there for the employee. How can I help you better do your job? So in this particular model, the focus is not necessarily on cost containment and efficiency, but this is the nurse manager who comes around and says to each nurses, how can I help you do a better job today? What do you need to get your job done? And in the long run, this actually may turn out to be more cost effective and efficient. Servant leadership is definitely more human-oriented because the nurse manager is seen as being supportive and not so authoritative. Nursing research has shown that 2/3 of new nurses leave their jobs because of ineffectual or incompetent management. Newly licensed nurses have found that a lack of support from their manager was the primary reason for leaving their position, second only to a stressful work environment. So these research findings point to the importance of having effective nurse managers who can use the servant leadership or the transformational leadership or the caring leadership or a human-oriented leadership model to create an environment in which nurses can feel comfortable, can learn their jobs, improve their clinical skills, and thrive. So what are the KSAs that a good nurse manager needs to have? The knowledge, skills, and abilities. Leadership skills, of course, especially around team building, relationship building, and mentoring skills, professionalism, ethics, clinical expertise, human resource management expertise, the ability to do performance evaluations, financial management skills in terms of being able to stick to a budget. And they also need to be able to coordinate patient care in terms of doing the schedule, planning the workflow, making work assignments, and monitoring the quality of care and the outcomes, as well as monitoring the documentation of that care. Other skills that good nurse managers need to have are networking skills, being able to work with others and develop teams. They have to be able to do conflict resolution and negotiation with employees, or often between an employee and a patient, an employee and a family member, the hospital and a nurse, or many different aspects. They have to be good at employee development, allowing nurses to attend webinars, continuing education. They have to be good at giving presentations and keeping everybody up to date on the latest hospital policies, rules and regulations, changes in nursing procedures, and so on and so forth. And also nurse managers need to have some coaching skills. This is a very valuable asset to have. They need to know how to share their experience and expertise with the rest of the staff so that they can nurture the overall growth and development of nurses to do a better job. Good nurse managers need to be able to make a lot of different types of decisions. They have input or authority over hiring and firing of employees, doing employee evaluations. They have to be able to manage a budget and do resource allocation, sometimes with limited funds. They have to be able to do planning for the future. What is this nursing unit likely to look like, and what are the needs within the next 2 to 5 years? And they will also need to be able to analyze and redesign the workflow of the unit to kind of make the department work as efficiently as possible in providing quality health care to the patients. So not every registered nurse aspires to become a nurse manager or nurse leader. Some become expert clinicians instead, or advanced practice nurses, maybe diabetes nurse educators, and so on and so forth, other kind of leadership roles. If you do decide to take on a job as a nurse manager, you will, in your first management role, be a novice again, kind of like a new graduate with your clinical skills. And you'll find that you're going to take on a whole new set of challenges. You can't be all things to all people. If you have unrealistic expectations of what you can and can't accomplish, then you may become overwhelmed by the demands of being a nurse manager. Nurse managers need to be effective at setting boundaries, developing new relationships and new types of relationships with colleagues and also mentors. And they have to undertake extensive personal growth, I think, to become a good manager. The recommendation is that you give yourself a full year to be comfortable in the role before you know if you want to stick with nursing management or maybe go into another aspect of nursing. And as you gain experience and expertise, you will be able to optimize the functioning of the unit and eventually become a mentor to all the new nurses in the department. So in conclusion, I just want to say that nurse managers have highly responsible positions in healthcare organizations, and their jobs are complex because the U.S. healthcare system is ever-changing and very complex. Managers who are not so effective may not be able to help the nurses who work on their unit, may not be able to help the patients, then they may actually have the potential to do harm. Conversely, highly effective managers can help nurses grow and develop as healthcare professionals, and they can provide very high quality care to the patients in their department. So if it seems that there are overlapping or even conflicting management theories, this is because management theory is still kind of in its infancy. We haven't been talking about this for many years, so it's kind of prone to fads and kind of prone to changes. So I would say if you're interested in learning about management theory in further depth, please just stay tuned for further details. Thank you very much.